Good morning, everyone. Hope you are well and safe. Thank you for joining with Halcyon Private Limited for our first webinar. As you know, this is based on updating emergency preparation plan for COVID-19 as per ISO 22000, 45001 and BRC standards. If you have any questions regarding this, you can send those to our WhatsApp group, Facebook page, and YouTube channel. We will communicate with you as soon as possible. So, I accordingly invite our trainer, Mr. Rasita, who is a lead auditor in ISO 9001, HACCP ISO 22000, and has 22 years of experience in consulting and auditing to continue the program.
Good morning to all of you. I hope you can clearly hear my voice. And sorry for the delay in starting. Like this is the new technology which we are going to use in future definitely. And the today topics, like what we try to do is update the emergency preparedness plan. According to there are few standards. Not only these standards, there are few standards like ISO 22000, FSSC 22000, and then the PRC. Then those few standard basically talk about the food safety requirement, and there's a one particular standard start to talk about the occupation health and safety requirement. So we are going to discuss all these activities, and today's presentation, like during this presentation, what we try to understand is initially there are five elements which we are going to cover. One is ISO 22000 2018 plus FSSC 22000 requirement. Both standards are which I mean like part of it. And I think in this gathering, like there will be people who are not very much familiar with the standard, but I hope I try to explain all the emergency preparedness plan, mainly because it will be a part of day-to-day activities. It's a requirement, but people who already having this standard with the certification, definitely you need to update your emergency preparedness plan in line with the COVID. And then second thing, we are need to talk about the BRC issue 8. This is the latest standard requirement. We are talking about the emergency preparedness requirement. And then ISO 45000 to the 2018 requirement. This is also a new requirement which is we are going to. And then there are local government guidelines already published on this requirement that we will discuss. And then based on these four main requirement, we need to update the emergency plan. So what is the major difference between the previous emergency plan and the current new one which is going to coming up? So we basically talk about new normal life for ourselves. Previous emergency plan, if you are very much familiar with the emergency preparedness plan, we talk about there are a few items, very common items we discuss: fire, flood, food poisoning, or disruption of essential service. Those are these things we require. We discuss at the emergency preparedness. So some of those activities we conduct the mock drills, emergency drills as well. So once a year that's activity. So these risks came from based on the probability and the severity. The severity is very high, but the probability magnitude is kind of low because due to some controls already available. But this COVID situation is an ongoing activity, and probability still we don't have any parameters because still the world has not come up with the vaccine to cure this. So it's an ongoing activity. But from next Monday onwards, we are going to start up the factory, and already some factories offices already started. But Monday onwards, the entire country will be start to operate. So this emergency preparedness plan, this has to be a kind of a live document. Not only the document, this has to be day-to-day practices. So this is very crucial, very important, and important to the safety of the people. Plus, at the audits, this should be a very crucial document and crucial system to prove, because even at the auditors they will question on this, and especially right now most of the certification bodies, they already start to do the online audits. There are few standards which they have not yet started, the food safety standard and all, but some of the standard they already discussing on the doing the online audit. So this will become a new normal life for us, right? So I will start with the ISO 22000 requirements. So according to the standard, it's the emergency preparedness is talk about element number 8.4 under that. So under general requirement, standard said, okay, top management shall ensure procedure are in place to respond potential emergency situation, incident, both can have impact on the food safety. So this has to be documented information. So emergency situation, incident can be a COVID situation. So there are a lot of activities we already discussed, but right now what we need to do is basically we need to cover the emergency situation for COVID situation. So this is the requirement by uh, the 2018 version. And according to the 842 element, handling of emergencies and incident, so the standard said organization shall, so these are must, respond to actual emergency situation and incident by, so there are two keywords, your emergency situation and incident by ensuring applicable statutory and regulatory requirements. So you have to make sure you are meeting all the legal requirements. And then very important statement, communicating internally. So standard said, okay, you need to communicate internally, and then standard said, communicate externally. You need to communicate externally as well. So then standard demand, take action to reduce consequence of emergency situation. We need to take action to reduce the emergency situation. Periodically test procedure where practical. So even 22,000 standard demand us to periodically test procedures where practical, and then review and necessary update the document information. So this need to be documented and updated. So then again, so that's the requirement by the standard. So initial phase, what we try to understand is the standard requirement, what they want for emergency preparedness. So as per BRC version 8, this is the latest version. So BRC is a little bit of tough standard, but I'm sure there are a few people already familiar with this standard. If you compare with the 22 and HACCP standard, this is basically tough standard. You will understand even from this element the requirement from this standard. So according to the BRC version issue 8, the standard talk about shall have plan and system in place to manage incident effectively and enable the withdrawal and recall of product. So this standard go one step ahead. It's not just talk about managing the incident, emergency situation. It's talk about product withdrawal and recall. Those, so they went one step ahead. And then under 3.11.1 requirement, standard said shall have procedure designed to report and effectively manage incident and potential emergency situation that impact food safety, legality, and quality. So this standard talk about three factors, key factors, not only the food safety, it talk about legality as well as quality, and then how we're going to manage the incident. And then this shall include consideration of contingency plan to maintain product safety, quality, and legality. Disruption to key service such as, so in this standard, basically they elaborate kind of few requirement. Water, energy, transport, refrigeration, staff, and communication. If there's a disruption, what is your emergency preparedness plan? Events such as fire, flood, natural disaster. And then the tricky part, this standard goes a little bit above the basic requirement. They start to talk about the forceful requirement. Malicious contamination, no sabotage. Those are emergency situations that also we need to plan out. And then failure of attacks against digital cyber security, because there are organizations, there are manufacturing system run by the softwares. So if there's a cyber security attack for this software, there can be a issue. Maybe data printing, weighing scaling, or maybe adding of ingredients based on the cybersecurity system. So those requirement also we need to consideration. So that's why I said like BRC version issue 8, it bit advanced, they, because their requirements and demands are bit much higher. When product which have been related from the site may affected by incident, consideration shall be given to the need to withdrawal or recall procedure. So we are discussing the withdrawal plan as well. Under 311.2 shall have a documented product withdrawal and recall procedure. So standard said, okay, we need to have a documented procedure for that. Identification of the key personnel consulting the recall management team. Clearly identify responsibility. So this is very important. In previous standard also that they said okay, need to understand the responsibility, but here they said like key personnel consult in the recall management team, and we need to understand the responsibility, identify the responsibility clearly, and guideline for deciding whether the product need to be recalled and withdrawal, and up to date list of key contacts. So up to date list of key contact has to be there. So in this is the demand by the standard, requirement by the standard. A communication plan, detail of external agencies provide advice and support. Right now, there are number of agencies has been different. There are so many agencies are coming up for emergency preparedness plan due to this COVID situation. A plan to handle the logistic of product traceability, recovery or disposal of effect product, a plan to record timing of key activities, a plan to conduct root cause analysis and to implement ongoing improvement. The procedure shall be capable of being operated at any time. So this is the ongoing live procedure has to be there. If somebody is not very much familiar with the traceability word, I'll take the example from the COVID situation. Say, but right now, what's government do is basically if they identify a COVID patient, what they do is they will go back the entire association chain and then identify the same scenario we need to do. So in food safety aspect, we have to identify two segment. One is backward traceability, other one is the forward traceability. So this traceability system has to be in place. Otherwise, you can't do a recall. And then this product recall and withdrawal procedure shall be tested at least annually. So standard said, okay, at least annually you need to test. So these three standard we covered 22,000 and FSSC 22,000 and the BRC version. Now this is a different standard, ISO 45,000 2018 version. So earlier this standard name as OSHA's 18,000 2007. Earlier it's a British standard, but right now they converted this into a ISO standard, right? So this standard talk about your people. The previous standard talk about your product, food safety, but this standard basically talk about uh, the 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 occupation health and safety of the people. So what are the requirements from this standard? These standard requirements are coming from emergency plan, coming from element number 8.2, emergency preparedness and response. The organization shall establish, implement and maintain process need to prepare for and respond to potential situation as identified in 6122. If you're wondering what is 6122 is assessment of OSHA's risk and other risks to the OSHA's management system. This including to talk about emergency preparedness and response, including establishing a planned response to emergency situation, including provision of first aid. So this is very important. We need to have a planned response emergency situation, including provision of first aid. So first aid situation we have to have, a station we need to have. Provide training for the personnel responsible. So persons who are responsible for handling emergency situation, they should train themselves how to handle this situation. Then periodically testing and exercising the planned response capability. Periodically we need to exercise and plan the response capability. Evaluation of performance and as necessary, revising the planned response including after test, and communication and providing the relevant information to workers on their duties and responsibilities. So this is very important. Communication and providing the relevant information to all workers on their duties and responsibility. Communicating the relevant information to contractors, this is very important. Visitors, emergency response service, government authorities, and as appropriate to local community. Taking into account the need and capabilities of relevant interested parties. So again, this standard said, okay, we need to have a documented information on this as well. So then, so we covered the basic requirement of the standard. So this is very clear. Standard basically said, okay, we need to have this requirement when it's come to the emergency preparedness. And then there are local government guidelines given. So according to the local government guideline, the latest one, operational guidelines on preparedness and response for COVID-19 outbreak for work setting. So this is an interim guideline published on 17th April 2020. Is published by Directors of Environmental Health, Occupation Health and Food Safety, Ministry of Health and Indigenous Medicine Service. So these are the guidelines. So I'm not going to go through the entire guideline because it's very informative guideline. All the industries should go through this guideline. If you don't have this copy of this guideline, just talk to us, and we will basically submit this guideline, because this is a publicly available document. And this guideline, there are a few areas which we need to discuss. In this guideline, you can see here specific guidelines given for different industries. I think based on the yesterday's discussion and all, so there are new guidelines coming for some other industries as well, including salons and all. But since we are coming from the industry background, most of the guidelines are covered here: manufacturing industry, government and private office, hospital industry, restaurant and factories, estates, supermarkets, public transport. So all the guidelines here. I'll take one more example because of the time factor. Manufacturing industry. So guidelines are given. Following the measurements are be adopted in the addition to the general measures described in the section 3 above. This part of the document outline the measures to following the factories to prevent, control the spread of COVID-19 infection and to promote the health of the public. So restructure the workplace. So basically they have given what are the guidelines you need to adhere. So before you start the factory, before you start your office, you need to go through this guideline and understand the requirement given by the guideline. And then we'll move into the most important part. I think this presentation. Initially, we try to understand the basic requirement and standard requirement, and then what are the government requirement is given. So we try to understand those activities, right? So then based on those activities, we try to identify what are the relevant factors which we are going to cover. And then the important part of the presentation is how to update the emergency plan. So here again, I'm trying to link with the ISO 45000 2018 requirement. The new standard pretty much emphasize on getting the consultation and participation of workers. What do you mean by workers? There's a definition for workers. I mean everybody work in the factory. It's not the operational staff only. So relevant process owners we need to, so we need to keep the social distancing with the people. So we have to live with it. So we'll try to adapt. I think like it's a part of adaptation, survival. So let's try to adapt, and thank you and welcome to back. I think initial phase we covered the requirement part from the standard, like what is 22,000 requirement, what is BRC requirement, what is FSSC requirement, and what is ISO 45 requirement, and then what are the government directives given. And then we come to the most important part, how to update the emergency plan in the standard. So according to this emergency plan, first thing, the things which we discussed initially was we need to get people involvement. That's the most important part, because when we conduct the emergency preparedness study, even ISO 45,000 standards said get the participation now and the consultation of the workers. I define the worker. Worker is not the operator. It's everybody. So say for example, if you want to develop emergency plan due to this COVID situation, we might need to get a driver's feedback. We might need to get a feedback from the security guard, because they are the people who most of the time they involve with the people. So we had to get the feedback from relevant people. So when you develop the emergency plan, don't just develop the emergency plan having a discussion with the top management only. Top management has to be involved with this. They are the custodian and they are accountable for this. There's no rule, but you need to involve everybody, most of the people available in the plant. So get involvement of the people, and then this, I think this is very familiar picture for us. PDCA, plan, do, check, that. So this is very, I mean, like people who very much familiar with the ISO standard, we say, okay, entire standard is purely based on the PDCA. All the elements are purely based on the PDCA. So what we try to do is, we try to improve our emergency preparedness plan based on the PDCA. Plan, do, check, that. Simple activity, but it's not that simple when you go through it. So plan. Why plan is very important? I say, if you fail to plan, you are planning to fail. So planning is very important. What sort of activities we need to see when you're going for the planning? So when you're planning the emergency preparedness plan, we goes by the PDCA. There are four factors we are very much focused on. One is facility, your organization, building, structure, surrounding, everything, and then your warehouse. It can be raw material warehouse. It can be packing material warehouse. It can be finished good warehouse, and then the equipment. So and the people. Fourth factor is people. So we are focus on your facility, your warehouse, equipment, and people. So I'm basically accumulating first three factors: facility, warehouse, and equipment into one segment, and the people into other segment. Right. So on the facility, when you do the planning, this is at the planning stage. Operation plan, usage planning has to be there. So you need to identify your operation plan, what sort of machine you are going to use, what are the locations you are going to use. That plan has to be there. Then understand the factory, office location, and department. You need to understand the basically based on the risk factors, based on the COVID risk factors. You need to understand where's your facility, factory situated, what sort of surrounding is there due to this COVID situation. Is a high risk area or low risk area? So that we need to understand. And what are the things going on near the vicinity of your organization? Maybe you are bringing food from outside, so those things we need to consider. Office location and the transport mechanism, all these things we need to plan. And then we need to identify gap between two machines or two working stations, because earlier uh, we try to cover the basic legal requirements, the workflow. But right now, due to this COVID situation, we need to maintain a certain distance. So we need to plan out what are the critical machine, what are the activities we need to do. Especially there are organization, we work on being all these concepts. So we need to adhere, we need to update according to these requirements. And then after you do this activity, you bring certain amount of people into the facility to run the operation. And then what about the toilet and the canteen facility? So those things, their seat arrangement, canteen seating arrangement, those things we need to plan out. And movement of the people inside the plant, outside or gate, because you can isolate people within the plant and keep a gap. But when they enter into the facility, how are you going to manage? Those things you need to plan. And then there will be some sort of a commonly used equipment that also we need to plan. Then we need to plan out sanitation plan, where you're going to keep your hand washing station, foot washing station if required, and then hand sanitation in between the plant, in between the department. That also we need to plan. Location for hand washing sanitation location plan. And then transport vehicle. Maybe most of the organization they use outsourced transport vehicle. So we need to understand the transport vehicle condition, and you need to plan. Okay, what is the vehicle? What is the route, and who will be the driver? So if possible, try to stick to one driver, one vehicle for one particular area. So then it will easy, if there's any situation arise, you can easily traceable those situations. So those things has to be planned. Medical center capacity and readiness to handle COVID-19 suspect. So that is also very important. Most of the organization they have a medical centers, or maybe if you don't have a medical center, you can have a temporary medical center. And then their readiness, because we know there's a unfortunate incident very recently we faced due to handling of the COVID-19 suspect people, right? So in our organization, we need to have a proper readiness. So that's planning has to be there. And then temperature monitoring equipment list and record has to be there. But recently we saw at the news, one particular person gave very strange answers when the PHI people asked about the temperature monitoring equipment. So mainly what we use is the IR temperature monitoring, because it's not touching the people. So those facilities we should have. And then most important part, the people. So we need to understand the people, location, and their residency. What sort of risks they are coming from. So there should be HR function will be very important. We need to understand the risk factors. And nomination of emergency control and emergency team for COVID-19. This is very important. We need to have a either if you can upgrade your emergency controller for COVID situation, or maybe you can have a separate team who's in charge and who's custodian of this managing the COVID situation. So you can have a multidisciplinary team to manage this situation. And then we need to categorize risk category as areas, and then you can have restricted access for particular areas. Say for example, if you're manufacturing a food product, final packaging, it's done by restricted people. So you identify who are the people who involved with the restriction area, and who has the access to this particular area. So then same time, this is very important. Organization should know employee history, family history, and their background, and who are the people they associate with. So those understanding has to be there. So a lot of work. And the traveling methodology and the distance we need to understand. And then production and office capacity planning, daily weekly plan has to be there. entry requirement for staff visitors. So especially if you want to entertain the visitors, especially like I think most of the organizations, they have to entertain the visitors, especially the maintenance staff or maybe your service providers, they have to enter into the factory. So best thing to have a plan for that, understand their people, get a declaration or checking, that has to be there. And moving one department to other department, maybe canteen entry requirement, those things has to be there. And then you need to understand the PP requirement for your organization, what sort of a face mask you are going to give or gloves. And then not only the provision of the PPs, you need to understand, you need to give a solution for discard of the PPs, that also we need to plan. So planning, they need to do a lot of planning activity under these four elements. Then after you start the factory, is it doing work? So what are you going to do? So it's simple. If you have a proper planning, it's a matter of lay down the agreed plan. Say what you need to do is facility, warehouse and equipment, operate plan with the agreed layout plan and no change authorized. So what we do is like initially you have a plan, then someone else, without getting a permission from the emergency control team for COVID, they do some changes. You can't do that. So you have to have a proper guideline. Say if you want to do some sort of a changes, structural or whatever the changes due to this COVID situation, you need to get authorization from this steering committee. And then one relevant person, approved equipment available on particular department. So there should be one relevant person and then approved equipment. Okay, this particular department is going to manage by only by this particular equipment. And then you have to make sure gap between machine and the two people. And toilet and canteen facilities operate on two or more number of turns, maintain social distance, because if you have a high number of people, just to maintain the social distance, you can have a, you can break it your meal breaks and make sure there's a social distance is maintained. Movement of people inside the plant limited to the department to department with proper hand sanitation. Like even previously we freely go into other department and have a discussion with the people, but right now what we need to do is we need to minimize the people movement. So there should be authorization for that. And even if you want to move from one department to other department, there should be a hand sanitation. And then commonly usage equipment to be avoided, if possible commonly used equipment to be avoided, or separate mechanism for cleaning management. So you need to have a separate mechanism for cleaning. Sanitation plan in place and in operational, including disposal of PP. So sanitation plan has to be there. And then disposal of PP is very important. See this one particular aspect. If your people wearing a face mask and if they go for a lunch, are you going to ask them to use the same mask, or are you going to give a new face mask? So those detail has to be planned at the initial phase. So then next thing you need to adhere to that at the due phase. And then transportation vehicle arrangement is available with the screening and with clear instruction including PP staff for transport vehicle transportation. Initially at the planning stage I discussed, if you can get a one particular vehicle with the number and the same driver for that one location, and then people seating arrangement also you can plan it out, then it's easy. If something goes wrong, you can easily track. And then medical center capacity and readiness for PPE suspect. So there should be a proper PPE for medical center staff who may be your emergency staff. Then they need to handle that situation properly. Right. Then people understand the location of staff residency and decision based on that. So if you identify your people are coming from a high risk area due to this COVID, maybe you management can take a decision, or maybe you can identify one particular people coming from one particular direction. You can ask them to work on a one separate department if possible. So those things has to be in the planning stage. Nomination of emergency controller and a team, that's very crucial. Again, they have to act, they have to run this system. Again, risk category as per the area, restriction access per people, and we need to review and study at least once a week their family history background. You need to continue this study until we come to a end of this situation. Understanding the traveling methodology, distance, their learning, positive negatives, all these things we need to study. Production and office planning capacity, when capacities start to move out, you need to have action plan for that, like people movement. Entry requirement for staff and the visitors. So what, there should be a proper guideline requirement and everybody should adhere to this guideline. Staff, what is the guideline they need to adhere? Visitors, there should be a proper approval process for them. And if possible, try to minimize the visitor entrance into the facility. Moving one department to department entry requirement that can be done, and then there should be an open incident communication mechanism. This is very important due to this COVID situation. If they come out with some sort of a symptoms, like if they come out with some sort of a, issues, they should communicate, and not only within the facility, even outside the facility, they should communicate, and that free culture we need to create during this situation. Then PDC checking, so it's very important. So if you lay down two factors, then what you need to do is operate plan and agreed layout, check against guideline, whether agreed frequency. So this is part of emergency team. They can do that. Check approval state of the employees with the temperature as planned interval. So depend on, there are some factories at the entrance they check the temperature. Maybe due to certain intervals they check the temperature due to risk factors. Only relevant people approval. So there should be authorization level. Maybe they can check the gap between machine. Spot checks you can do. Check the toilet canteen facility operating two or more turns. Maintain social distance, because our human nature is that we are social animals. So people, what they try to do is, like, whenever they have a chance, especially at the canteen, they try to get together and discuss. So just make sure when you do the checking, just make sure, advise them just to keep the social distance. Check the movement of people inside the plant, limit to department to department. So minimize the people movement. Use the electronic media. Even for documentation, earlier sometimes you used to sign a document and send it to the department wise through a PM, and then try to minimize. And especially tea, one good example for manufacturing facilities and the other offices, there's a one particular person give us a tea, so that person travel entire organization. So if possible, try to minimize those activities as well. Check the common use equipment, avoid if possible, or otherwise have a frequent cleaning mechanism. Make sure your sanitation plan, agreed plan, is in place. So checking, you can check whether the sanitations are available, sanitizers are available, and maybe the sanitizers are on agreed quality, because that's most important. Because sometimes we use hand sanitizer with the alcohol and expecting that sanitizer is more than 70% of the concentration. But if you got lower concentration, then it's not effective. So the checking team has to get that kind of approval. There are guidelines given by the WHO. Check the transport vehicle arrangement is available with the screening and with the clear instruction, including PPEs for staff. Even during the transport vehicle, you have to check all this seating arrangement, because you can number and give the seating arrangement for these people. And then you can check the medical center capacity, and you can do a kind of a mock study and see whether your medical center people are capable of handling this COVID-19 suspect if they identify, and whether they have the numbers, correct numbers, to communicate with them, and with the proper PPEs, how fast they can wear the PPEs. So that's another mock study you can do under checking. Check the visitor management system and approval process. So you can study the number of visitors who visit the factory and their approval state and their numbers. So you can do all this checking, and check warehouse management and accept of raw material and dispatch. Because see, warehouse management, this is one crucial area, because most of the time organization, you allow some other department, other people from other than your organization to come in and maybe dispatch the product, or maybe take the product from your organization. So then there can be some sort of a contamination from them. So you have to study that activity as well, because that's the crucial. Maybe they are going around the country, and if they are infected, so then they can become a kind of a, there can become a kind of a transparent to your organization. So we need to have proper guideline for that as well. So under checking, you can check all these scenarios. And then people, you can check staff residency location, because sometimes people accidentally or deliberately they give a wrong information. So you can check whether their actual residency is there, whether their given phone numbers is working. So those things we can check the restriction access for people and entry requirement. So you can have a guideline, say this particular department, these are the people who's available for operation. You can check those. And employee history, family history, background, this is very crucial, because we identify there are certain incidents came out due to this situation. So HR, you have to do this part, maybe your emergency plan. Somebody has to take on these activities. Check the understand the traveling methodology, distance. So that also we need to check. Production and office capacity planning for people. Check the entry requirement for staff, visitors. So you can observe, say entry requirement is done by security people, But as a emergency preparedness team, you can observe whether they are doing it correctly or wrong. Temperature monitoring, whether they are it wrong, or maybe hand washing. You ask people to wash hand for 20 seconds using the soap, using the detergent. So you can check whether they are doing it correctly or wrong. Check the movement on one department to other department, especially canteen and all. So you can check those parts. And then finally, action, prevent COVID situation. So there are a few actions under normal situation. Minimize the physical meeting gathering if possible. See, right now we're supposed to have this meeting one to one. So then at least we are connecting each other. But right now we are communicating the same content uh, using the different methodology. So we keep a kind of a distance between us, social distance, but we are doing the job. So we need to find different ways, but there are difficulties we are facing right now. But we need to find a way. We need to come out with this. We have to make sure this is the our new operational method. So that one way. So social distance, if possible, keep the social distance always. Communication, COVID-19 control and current situation, awareness program. So you need to communicate with your people what is the current situation, awareness program. There are a lot of new things are coming up, new development, new identification, and there are countries, there are factories, there are good practices, so you can share and communicate with them. Promote incident reporting culture in line with COVID-19. So best thing, get people involved with this. If they identify a situation, say I have a situation in my neighbors, so let them come and communicate that. So if you can open up your culture up to that level, that will solve a lot of issues. Hand washing, hand sanitation. So I think food factories, already we are into this hand washing, hand sanitation facilities because it's part of our GMP requirement. But other non-food facilities, this will be a way of life right now. So you have to have hand washing, hand sanitation facilities. So always you need to wash your hands, and when you move out with the people, and now the hands shakes and all basically we need to stop. And incident handling procedure and contact at least mock study. So you need to have a proper incident handling situation. If you identify incident, you need to quickly respond, and then you need to do a kind of a mock study. And data collection, this is very important. Employee history, hand washing, all this data collection has to be there, and then somebody should alert about what is happening in the country, what is happening in the particular district, surrounding, what sort of activities are taken place. You need to study them. So then same time we need to give guideline for employees during the transportation, not only transportation, not only the factory. You need to give guideline, even at the home, even at the village, you need to give that guideline. And then especially, this is one important factor which we tend to forget, disposal of PPEs. We need to have a proper disposal mechanism, and you can't, because that can be another contamination source. So we need to have a proper disposal mechanism, and then communication with the government authorities. So we need to have a numbers, PHI numbers. So once you start the factory, without them coming into the factory, you can invite them and ask them to come to the factory, because they have a lot of experience during last 8 months. So get their experience and get their guideline, and maybe you can run the factory. And you need to have a contact list of government authorities, including emergency vehicle, hospital, so nearest hospital, all these numbers you need to update in your emergency plan. And then there should be a suspect handling situation. There should be a mock study report, and then you have to have handling procedure after the situation. So these are the basic requirement which we are going to discuss. So in this presentation, short presentation, we basically discuss the standard requirement. There are 4 standard we predominantly discuss, like ISO 22, FSSC, BRC, and ISO 45000. Initially, we understand the requirement given by the standard. Then second phase, we understand government requirement. And then finally, we understand what we're going to do to update our emergency preparedness in line with the standard requirement and in line with the government requirement. So the methodology we adapt is the PDC Plan, Do, Check, Act. So based on this Plan, Do, Check, Act, you can update, you can use this information. So if you have any question, I think you can comment on the group and all. So we'll try to answer those questions as well. So thank you very much for your participation, and hope this will be useful for your updation of the program.